Good morning everyone and welcome to the Cabinet meeting. I'm Councillor Amanda Hopgood, Leader of Durham County Council and Chair for this meeting. The meeting is being broadcast live through our YouTube channel, so before we commence today's formal business, I'd just like to cover some of the housekeeping issues. If you could please switch off or make silent mobile phones. Keep microphones switched off at all times unless invited to speak by myself as the Chair. And when invited to speak, please can you switch on the microphone nearest to you and introduce yourself. So with that, we'll move on to the agenda. Item 1 is public questions. We haven't received any questions for this part of today's meeting. Item 2, can I have a mover and seconder please for the minutes of the meeting held on the 6th and the 27th of April.
Councillor Mark Wilkes will move the minutes, Chair.
Thank you. A seconder please.
Councillor Richard Bell.
Right, thanks. We've got 2 seconders. We'll put down Richard Bell. He got in there just first. Thank you. Can we agree the minutes are a correct record? Agreed. Thank you. I can confirm therefore the minutes are agreed. With that, have we... Item 3, declarations of interest. Does anyone have any declarations to declare? No? So item 4 is the Annual Enforcement Programme, Children and Young Persons Protection from Tobacco Act 1991 and Anti-Social Behaviour Act 2003. If I can ask Alan Patrickson, Corporate Director of Neighbourhoods and Climate Change, to present the report, please.
Thank you, Chair. This report sets out the priorities for the coming year for the enforcement programme relating to the protection of young people from age-restricted products and describes some of the activity in this area from the year just gone. The report reviews activities under the Children and Young Persons Protection from Tobacco Act of 1991, the Anti-Social Behaviour Act of 2003 and the Licensing Act of 2003, which collectively set out the Council's statutory duty in respect of enforcement of age-restricted products to under 18s. The Council has taken a long-standing and a proactive approach to the protection of young people, tackling harms and criminality associated with the supply of age-restricted products. And this has been helped by a strong partnership work with the Police Licensed Economy Team, the County Durham Tobacco Alliance, HMRC and others, working on both enforcement and also, importantly, on education and awareness activities. It's important to note for this report that the impact of COVID has inevitably had an impact on this work over the last 2 years, and as we now begin to emerge from the pandemic, we're able to relaunch many of the activities that make up this important area of work. I'm pleased to be able to report, however, that despite the restrictions placed on us through the pandemic, work has continued with some notable successes in the ongoing activity against sales of illicit tobacco, with some substantial seizures of cigarettes, tobacco and cash under the Proceeds of Crime Act. These are described in further detail in the report. Legal action has been taken against one retail premises and it resulted in forced closure for a 3-month period, which was then extended for a further 3-month period due to further non-compliance. Further warrants were issued on 7 premises and 27 cease and desist orders were issued to low-level domestic sellers. In the area of education, we continue to support the Keep It Out campaign to raise awareness of the harm from illicit tobacco. The report also covers areas for future attention and highlights among these new regulations relating to the use of Botox for cosmetic purposes, designed to ensure that young people are protected from the potential risks of such procedures, both physical and mental. Also highlighted for attention is the safe supply and use of vaping and e-cigarette products, and also new responsibilities under the Offensive Weapons Act of 2018. Paragraph 41 of the report sets out the key priorities for the enforcement programme for 22-23, which includes a range of activities covering not only our continuing intelligence-led partnership approach to enforcement, but also education, training and awareness activities. The continuing work on the Keep It Out campaign is highlighted, as is the Tick Box initiative, working with the self-storage industry to adopt good practice to help prevent storage of counterfeit products. There will be a continuing focus on disrupting illicit supply chains and responding to intelligence from the trade and also from members of the public. Chair, the recommendations are set out in paragraph 13.
Thanks, Alan. Can I invite Councillor Mark Wilkes, Cabinet Portfolio Holder for Neighbourhoods and Climate Change, to speak to the report, please?
Thank you, Chair. And presenting this report today in the absence of Councillor Shuttleworth. And this sets out our priorities for the coming year for the protection of our young people against improper use of age-restricted products. The report sets out a summary of our activity in this area over the previous year, a period during which operational activity was severely affected by the COVID pandemic. It was essential that we fully considered the health and safety and welfare of both our enforcement teams and also those excellent young people involved in this work during this time, and adjusted our activities accordingly. Despite the difficulties, however, we have continued to have a number of successful operations, with action taken against illicit tobacco operators and also retailers failing to uphold the necessary standards. The work carried out in this area has helped in County Durham by the strong partnership work that we have with relevant agencies, including the police and other enforcement agencies, along with the members of the County Durham Tobacco Alliance Partnership. The report also sets out some of the new challenges emerging, including issues around e-cigarettes and vaping products, where counterfeit and substandard products are appearing on the market and present a risk to young people, and also new regulations controlling the administration of Botox beauty products to under 18s. This legislation aims to safeguard our young people from the potential physical and emotional damage that such procedures could present if not properly supervised. Chair, this report sets out a comprehensive set of priorities for our community protection teams for the coming year, and I'm happy to propose the recommendations. Thank you, Chair.
Thank you. Can I invite Councillor Alan Shield, Cabinet Portfolio Holder for Equality Inclusion, to speak to the report, please?
Thank you, Chair. This is an extremely comprehensive plan encompassing intelligent-led enforcement activity, along with important public awareness and educational activities across the county and across the region. This includes working with businesses themselves to ensure that they are aware of their responsibilities. It is vital that these elements work together to help protect our young people and raise awareness of the risks that age-restricted products can pose. I'm heartened to see that despite the restrictions brought about by COVID, we have continued to work with our partners, including the police and Her Majesty's Revenues and Customs, to bring about convictions and confiscations. It sends a strong message to potential perpetrators that we will remain vigilant. The new developments set out in the report, including vaping products, offensive weapons and beauty products, are in some ways a reflection of the pressures that our young people can be subjected to from the way that culture, fashion and beauty are represented in the media, including on social media. And the role of enforcement and education activities is important in restoring balance and providing protection against the physical and mental harms that may be presented by such activities. Chair, the report sets out clear and comprehensive priorities for this important area of our work, and I am happy to second the report. Thank you.
Thanks, Alan. Is there anyone else wishing to speak to the report, please? Okay, can we agree the report and its recommendations? Agreed. Okay, I can confirm that the recommendations are agreed. That will move on to item 5, which is the Health Protection Assurance Annual Report. If I can ask Amanda Healy, Director of Public Health, to present the report, please.
Thank you, Chair, and morning everyone. The purpose of this report is to provide members of Cabinet with an update on health protection assurance arrangements in County Durham, and also some of the activities that have taken place over the course of the year. This report covers screening, immunisation, outbreaks, strategic regulation interventions, building on the previous report, and also our preparedness in response to incidents and emergencies. It doesn't cover COVID-19, which has obviously been covered extensively in rich reports every 2 months to the Health and Wellbeing Board. And the report sets out in the background the statutory responsibilities that the local authority has in relation to having plans in place to protect their population and having the assurance that those plans are in place. None of this work happens in isolation. We work very closely in conjunction within the Council with our Community Protection Service and also our Civil Contingency Unit. However, we also work really closely with colleagues at the UK Health Security Agency and our local clinical commissioning group, as well as NHS England and Improvement. We also will be seeing in the coming year some changes to those arrangements with the Health and Care White Paper, and we'll see that CCGs will then become part of the Integrated Care Board, and that will take additional responsibilities, including becoming a responder in terms of emergencies, and we're working with colleagues in relation to that. Paragraphs kind of 17 to 44 outline the extensive arrangements that we do have in County Durham for the assurance of health protection. And we have a Health Protection Assurance and Development Group, which has continued to meet during COVID, which oversees those key areas, including immunisation and other communicable disease outbreaks, for example. And there are a range of subgroups that report into the Health Protection Assurance and Development Group that are outlined in that section of the report. I think one of the areas of a real strength in County Durham is that the Clinical Commissioning Group have retained an in-house team of infection prevention control nurses, and they have been really invaluable during the pandemic, working not only with our care homes, but have extended their work with our schools and residential, but also this stands us in good stead for wider infection control interventions, including work on flu, for example, that has taken place in the last year. What we see then in terms of those arrangements is, and I'll come back to recommendations, is we'd like to see a review of the governance of those, because there's been lots of groups that have developed during COVID and were there previous, and we'd like to bring those all together. Just updating on some of the key areas in relation to health protection, and the scorecard is outlined in Appendix 2. What we've seen, certainly in terms of our screening programmes, is that they were all affected during the pandemic, but some have recovered better than others. We have seen our cervical screening programme, which is commissioned from NHS England, see a really high coverage of over 75% compared to a national average of 68%. And our bowel cancer, which is still a fairly new screening programme, again higher than the national average. However, what we have also seen is some of the others that are still in recovery from COVID, including our abdominal aortic aneurysm screening programme and our diabetic eye screening. And they are things that we will be seeking assurance of in the coming year. For immunisations, we have a really strong history and track record of very high immunisation uptake with our, particularly our childhood immunisations, which can be seen in paragraph 55, where we have seen over 98% of our children having one dose of MMR at age 5. And we also look beyond these to ensure that there's fair access and uptake right across County Durham for those really, really critical immunisations. However, what we have seen is a slightly lower uptake for the HPV vaccination, and we'll be working with our school-based programme to increase that in the coming year. We also know that shingles has remained stubbornly low, and again, our immunisation board will be looking at this in the coming year. Although our focus from a communicable disease perspective has been firmly placed on COVID, between ourselves and colleagues at UCSA, we have in the last year had to address quite a range of non-COVID infections, including meningitis, some quite complex TB cases, avian flu, flu outbreaks and also Legionella. And I'm really pleased to report that we've developed, very systematic pathways of care for a number of those. We've also been working very closely with colleagues as they develop work in relation to Ukraine, and if we are welcoming people from Ukraine, looking at their health needs and the health protection needs as well. So very much working with others in relation to communicable diseases. Building on obviously what the Corporate Director Neighbourhoods has just reported in terms of strategic regulation, colleagues within the community protection team work really very hard, particularly in relation to our food safety, pollution control, housing standards, and we'll see a lot of that coming back to the fore in the coming year as people are now out and about again, attending events, etc. So they're a really critical part of our health protection infrastructure. And then finally, in relation to response to incidents and emergencies, we've obviously seen, further to COVID, we've seen obviously winter storms, but we've also seen the testing of some of our key sites across County Durham, and we are redeveloping our kind of excess deaths framework based on learning from COVID. So we do have an action plan that sits behind the Health Protection Assurance and Development Group. Some of those key achievements I've outlined that are identified in the report. We've also got some areas where we are seeking further assurance, Chair, and this is very much based on collaborative working across our system with some priorities for the forthcoming year. And Chair, the Cabinet is recommended to note the contents of the report and the further recommendations are outlined in paragraph 5.
Thanks, Amanda. Can I invite Councillor Paul Sexton, Cabinet Portfolio Holder for Adult and Health Services, to speak to the report, please?
Yeah, thank you, Chair. Health protection is a statutory function of the local authority. The Director of Public Health has updated Cabinet via the report on arrangements that are in place to protect the health of our residents. This work relies on the excellent collaborative working arrangements between partners such as UK Health Security Agency and NHS England, as well as local colleagues within County Durham Council and Health. I'm pleased to see in this detailed report the excellent performance across all childhood immunisation programmes, over 95% uptake, and the ongoing recovery of screening and other immunisation services whose delivery was impacted by the pandemic. Additionally, the collaborative work undertaken to identify variations in second doses of the MMR vaccine within County Durham and address this via the delivery of a catch-up programme. Also, the increased uptake of flu vaccinations in eligible groups and amongst local authority staff, and the positive development to align the governance arrangements for the flu and COVID-19 vaccination programmes via the Immunisation Board. I also note that the developments highlighted for the next year, including the ongoing work with schools and providers to ensure improved rates of vaccination amongst adolescents and learning lessons from the COVID-19 vaccination campaign to ensure equity of access. Understanding reasons for the underperformance for newborn and infant physical examination and to ensure remedial measures are put in place. And ensuring health protection and public health related emergency preparedness is assured during organisational changes. I would also like to commend the extensive work undertaken and the assurances provided across the wide-ranging health protection agenda, whilst officers have also addressed the unprecedented demands of the COVID-19 pandemic. This report shows there has been significant change to health protection structures and processes during the COVID-19 pandemic, and I welcome the review of the health protection governance arrangements as we transition to living with COVID-19. I'd also like to add my thanks to Amanda, Jane and the whole team for pulling this report together, and I'm happy to propose the report, Chair.
Thanks, Paul. Can I invite Councillor Alan Shield, Cabinet Portfolio Holder for Equality and Inclusion, to speak to the report, please?
Thank you, Chair. I'm very pleased to be able to speak to this report. Protecting the health of our residents is of the utmost and primary importance and is wide-ranging, as can be seen in the report. I acknowledge that the sustained delivery and performance in County Durham across all childhood immunisation programmes the majority of which exceeds national standards and averages. The report provides broad assurance that effective processes are in place for each of the key strands of health protection activity, despite the significant challenges that the COVID-19 pandemic has presented. County Durham has retained the Infection Prevention and Control Nurses team, and since September 2020, the service has been extended to schools providing for children with special education needs and children's residential homes to bolster their infection prevention and control support across County Durham. The report also highlights the wider health protection work delivered in the past year, including the production of a briefing identifying health and wellbeing issues and implications, which has informed the ongoing work to support the response to the humanitarian crisis in Ukraine. I am therefore able to second this report and look forward to receiving future reports providing updates on the actions and developments outlined in this report for the coming year. Thank you, Chair.
Thanks, Alan. Is there anyone else wishing to speak to the report, please? Yeah, Councillor Bell.
Thanks, Chair. This is an important report because it does provide anybody who is interested with the effect of COVID on our preventative health services a snapshot of where we are. And it's clear, as has been said, that some services such as screening have been affected. Yet I note at paragraph 46 that in 3 areas, cervical screening, bowel cancer screening and breast cancer screening, we remain above the national average. And has also been pointed out, the childhood immunisation performance at paragraph 55, typically about 98, is very good indeed, and that's why it warrants a mention in the recommendations at paragraph B, noting that all childhood immunisation exceeds both national standards and national averages. And I think we need to take the opportunity of approving this report to say a big well done to primary care and all the people who worked through the disruptive times of the COVID pandemic to ensure that the regular preventative work that's so important actually remains on track. And it's very pleasing that it's on the whole remained on track as well as it has. So thank you for the report, and I fully endorse it.
Is there anyone else wishes to speak to the report? Okay, so can we agree the report and its recommendations, please? Okay, I can confirm that the recommendations are agreed. It takes us to item 6, which is any other business. I haven't been notified of any other business, so I'd therefore like to thank everyone for taking part, and to those members of the public and media who have watched this meeting this morning. That concludes the business for today.